Hello everyone, this is Dr. Dean Smith with Chiropractic Science. In this short video, I'd like to go through what evidence-based practice is, along with a search of PubMed to search the scientific literature for chiropractic-related topics. The first question that often is asked is, what's the purpose of evidence-based practice? In chiropractic, the idea is to promote effective chiropractic practice as well as enhance public health. Evidence-based practice usually incorporates three things that are talked about in the literature: the best research evidence out there with individual clinical expertise and patient choice and values. Today we'll be going through how to search for research evidence. There are some barriers to evidence-based practice for chiropractors, and last year a study came out that suggested lack of research relevance, lack of time, and insufficient skills in locating and appraising research were the top reasons or top barriers for evidence-based practice for chiropractors. The evidence-based practice process involves becoming proficient at incorporating the three steps mentioned in the previous slide to get the best evidence, to incorporate your clinical expertise as well as patient values. But ultimately, the idea is that once you become proficient, this actually will improve your patient outcomes. There are various steps to incorporating evidence-based practice. We want to formulate an appropriate question when we start to search through the scientific literature, perform an efficient literature search, critically appraise the best evidence, apply that best evidence to practice, and then assess your outcomes of care. One common way to search the scientific literature is to use this Pico format. So questions about any treatment would involve four components typically. First, we want to assess what is the patient problem that you're trying to investigate. What's the intervention that you're interested in looking for? Are there any comparison interventions you want to compare that treatment to? And what is the outcome of the treatment you're looking into? So I've just put together something here in the Pico format. So let's say you had a patient with sciatica. So that would be the P, the patient problem. The I that you might be interested in might be chiropractic adjustments. Of course, we have all sorts of names for this: chiropractic manipulation, etc. And depending on who you ask, you'll get a different answer about what to put there, what to call it. The C, the comparison intervention you might want to compare chiropractic adjustments for sciatica with might be surgery, and then the outcome could be pain. But the outcomes could certainly be any number of things. They could be range of motion, could be quality of life, etc. And so we can go through and go to PubMed next, and we'll find out that there are different terms that PubMed uses for each of these concepts. So for sciatica, PubMed sometimes use the terms radiculopathy, intervertebral disc displacement, or sciatica. Sciatica works as well. And in PubMed, there's something called MESH, medical subject headings. And I'll show you in a literature search here in just a few moments how all of this looks. The next thing to talk about is the levels of evidence hierarchy. At the top of the evidence pyramid, we have meta-analyses, systematic reviews, and clinical practice guidelines. That's what CPGs are. These demonstrate the highest level of evidence we have. Meta-analyses and systematic reviews essentially look at randomized clinical trials and use some fancy statistics to come up with the best levels of evidence. Of course, those kind of syntheses are requiring studies to already be done, and those include randomized controlled trials and non-randomized trials. And then toward the lower levels of evidence, we have observational studies, case reports, and simply expert opinion. Next, let's do a literature search through PubMed. So if you go to pubmed.com in your browser, that's what we'll be using for this particular scientific search. You can also use other things like Google Scholar. You can use Index to Chiropractic Literature. There are many other search engines that you could possibly use, but we'll use PubMed for this demonstration. If you noted on the slide presentation that I had up just a second ago, there were mesh terms that we talked about before. So if you see on the right-hand side of PubMed, it says mesh database. Go ahead and click on that, and it'll bring up the mesh database here. So what we're going to do is look for some of the terms. So sciatica was the patient problem, and we wanted to compare sciatica, chiropractic treatment, as well as surgery for sciatica. So we can see that sciatica is listed at a medical subject term, so that's fine. We can just make a mental note of that. But notice also here that it goes by different names: sciatic neuropathy, radiculopathy, intervertebral disc displacement. So we'll make a note of some of those terms because those are terms that we may want to include in our search also. What were some of the other things that we had in our Pico format? So we just got the P, the patient problem, was sciatica. The intervention that we were interested in were chiropractic adjustments. So we'll type in chiropractic adjustment into the medical subject header here, and we call that, or PubMed calls that, manipulation, chiropractic. If you look down, there are some other entry terms here: chiropractic manipulation. How about simply spinal manipulation is another term that's frequently used in the scientific literature, and so that would be manipulation, spinal. All right, so that's our intervention, and then we want to compare that intervention to surgery. So we'll type that into the medical subject header here, and we can find two other entries for surgery: general surgery and surgical procedures, and or just simply surgery, as we see here for number 3 under medical subject headers. Okay, so the outcome of interest is pain, so we'll type in pain, see if there's any other terms that people give it, and sure enough, pain is sufficient unless you're interested in acute pain or pain management or something like that. So now we have all the terms that we're interested in using by going through the medical subject headers. So what we're going to do is actually do a search. I'm going to scroll all the way down to the end of the page and click on PubMed here at the bottom, and that'll bring us to our search. I'm going to go ahead and click on Advanced right underneath the bar here, the search bar, and that brings up a series of fields. So this is the PubMed Advanced Search Builder, and I find this an easy way to search for our Pico format, which is a good way to try to answer scientific questions. Certainly not the only way, but it is a pretty decent way. It provides a nice format for us. So in the first field, let's type in our P from Pico, which was patient problem. So in that particular case, it was sciatica. And we also want to add in some other search terms that we came up with on the mesh search, which were radiculopathy. So I'm going to type the word "or" because we want to include that. So radiculopathy or intervertebral disc displacement. Okay, the next search terms that we want to include are the I from Pico, which were the intervention. So that would have been chiropractic adjustments, but in mesh, we learned that chiropractic adjustments are usually called manipulation, chiropractic. But oftentimes in the literature, manipulation is referred to as spinal manipulation, and in mesh, they call that manipulation, spinal. Okay, the next set of terms that we want to look at are for the control or comparison intervention. In this case, that was surgery. So we'll put that in the next field. And the next thing we want to look at is pain. That was the outcome. So that was the O in Pico. So we'll enter in pain. Now we can see, if you want to see how the search is laid out here, you can look at the top. But we'll just go ahead and click search and see what we get. Okay, so we ended up with 83 results. If you just randomly typed in sciatica and chiropractic or something like that, you may get a whole lot more hits or less, depending on what your specific search terms were. But in this case, I just want to show you a couple of features here. If you look at the left-hand side on the sidebar here, article types, you can customize what kind of type of article you want. So if you wanted to, for example, select only a review or a systematic review or a meta-analysis or guidelines, you can do that on this left sidebar. And those would be the highest levels of evidence. So if you're just interested in the highest levels of evidence and you don't want to read about individual studies, you can certainly do that and limit your search. But for now, I've got several things selected here. And I just want to show you how to look at some of these results. So some of the results are not going to be exactly necessarily what you want. So this first one looks like a great paper, but it's a case series. So if we're looking for a systematic review in particular, let's scroll down and see if we can find a systematic review. Here's a New England Journal of Medicine clinical practice. So that looks like a review paper on herniated discs. So that's interesting, but I'm not sure that's what we're exactly after. So if we keep scrolling down, here's one, number 10, that looks pretty much right up our alley. Comparative clinical effectiveness of management strategies for sciatica, a systematic review, and meta-analyses. So that sounds perfect for what we're interested in. Hopefully it'll answer the question that you have. If you, or once you're in this page, you can see the name of the journal here, in this case, Spine Journal from 2015. At the top is also the title, all the authors listed here. And then it gives the background, methods, results, and conclusions. So let's take a look and see what kind of conclusions this meta-analysis came up with based upon our search terms. So the results are really right here. For overall recovery as the outcome compared with inactive control or conventional care, there was a statistically significant improvement following disc surgery, epidural injections, non-opioid analgesia, manipulation, and acupuncture. So I think this is probably a good paper to answer a question. It seems that these are the things that seem to help with sciatica. So manipulation does seem to help, along with several other options here. And another thing that is almost equally beneficial in knowing are these at the bottom here: opioids, education advice alone, bed rest, percutaneous discectomy were inferior to most of the other treatments. So there may be some things that you find out, hey, this is probably effective, and these other things are probably not effective. So, well, that's it for the quick run through of how you can use a Pico search strategy in PubMed to hopefully find something relatively quick and find the information you're looking for. Thanks, and stay tuned. We'll go through on upcoming videos on how to appraise the scientific literature, but hopefully this was helpful. Thanks. Bye for now.